When would you recommend starting prostate vitality guard? And what would be the daily dose for a patient that was recently diagnosed as having edema of the prostate with a Gleason score of 9 and a PSA of 9.34, no bone metastasis on the bone scan, and the patient has multiple urinary symptoms of BPH?
Well, I'm going to use this as a teachable moment because I don't know enough about the case to be anything other than concerned. I'm sure the question also is raised by people who are concerned. And let me focus on the first point of concern, Professor Gleason and his score, because a Gleason score of 9 is elevated. Now, most conventional urologists at that point would recommend a biopsy, and I would not. They might recommend some hormone suppressing prescriptive solutions, which I might or might not agree with, but I would not be eager on their behalf to recommend. And PERQUE prostate vitality guard is to promote the health of the prostate. It does not treat malignancy, of course. And I'm not saying this person has malignancy, but I'm saying this person has many reasons to be concerned, not the least of which is the inflammation or repair deficit causing swelling in the prostate. I would recommend a magnetic resonance imaging of the prostate, an MRI of the prostate. I would recommend not doing a biopsy because I have been aware of too many cases where the needle was withdrawn, abnormal cells continued to grow. So while needle biopsy is commonly done, my dear friend Abdul Aziz had 7 needle biopsies before I finally prevailed upon him to stop that. Functional MRI of the prostate is not widely available, but is available. And I do recommend it as a non-invasive tool. And you can use it as a baseline as well as over time to measure changes. And the original question, I think, included, at what age would I recommend that a man start prostate vitality guard? And the answer is 40, unless you have a positive family history, in which case I would start at 30. It is clear that most problems that become symptomatic later, like when you're in the 50s, 60s, and 70s, have their origin in midlife. And so PERQUE prostate vitality guard is your friend, starting at about the age of 40 and throughout lifespan. If you have, if you get up multiple times at night to urinate, it's highly likely that PERQUE prostate vitality guard will reduce that. It is a combination of nature's solution to prostate health. And we have been fortunate that people who have been very intensive about managing their prostate malignancy reported that PERQUE was an important piece of promoting their health and vitality, even though it wasn't specifically treating a malignancy. So there's a lot of aspects to prostate health. They're all combined, each one with an evidence and an empiric base. And of course, we use the natural and most refined, which means the least contaminated form of all of these nutrients. And we combine them, in this case, in a special micellization soft gel that is small, but really quite effective, and promotes the health of the prostate in many different ways.